next speaker is Dr. T. Ravindra. He is the head of the Glaucoma and Cataract Department at Shankar Eye Foundation, Vizag. He has a vast experience in dealing with cataract and glaucoma. And he is speaking on an understanding of wound healing and predisposing risk factor. Over to you, Dr. Ravindra, sir.
Thank you, Dr. Devendra. Thank you, RK, sir. Thanks to all the audience for being present on this afternoon. Wound healing is the key requirement for a successful glaucoma surgery. Proper wound healing is to be not too much and not too less. Too much healing will result in failure. Again, pressures will increase, and if the healing is impaired, then it may lead to hypotony and its complications. Not just for trabeculectomy. The trabeculectomy is the gold standard, but even for the other glaucoma procedures, the scarring is a key factor. Means it should be controlled and minimized, and then only the success will come. Otherwise, even the MIGS can become MEGS or minimally effective. So the aim of a proper glaucoma surgery is to maintain the pressures within this green zone. If the pressures increase towards the orange or red zone, again the risk of progression is there. And if we are able to maintain the pressures of the eye for 10 years in the range of 10 millimeters, then only the gold standard will really be gold. And it is possible only with further advances to the techniques of control of healing, control of wound healing. To be understood in detail, active inflammation that is seen by the red color of the vessels is something that we see externally, but internally it is all microchemicals. Microscopically active factors are involved, and we have to understand that inflammation is one thing that occurs immediately, that is a phase 1, and fibrosis is something else that starts at around the day 7. And both these require distinct approaches. Some of the cell culture treatment studies have shown that the fibroblasts become more active in the presence of macrophages. Therefore, we have to understand how to control the macrophages in the initial part of the surgery, and then how to minimize the contraction of the fibroblasts in the later on phases. So intraoperatively, the surgical technique is important, the pharmacological adjuvants are important, and if we are using the physical spacers are important. And postoperatively, how we use the steroids, how many weeks or months, and then at the appropriate time, what we do about the digital or ocular compression and compression sutures, suture lysis. The decisions related to these are very important for a successful modulation of the wound healing. Now coming to the preoperative factors, the duration of treatment that has been there before the surgery has been undertaken is very important. How many molecules were there, and what was the vehicle, means whether it was affecting the macrophages level and cytokine levels in the conjunctiva. That is very important. and the resulting conjunctival deterioration can affect the outcomes adversely. And so, whether the holiday to the medicines, to what extent it can be given, and whether the steroids are used for 3 days, 5 days, or 15 days, those factors also ultimately lead to resulting conjunctival improvements and are very important for improving the outcomes. So there are studies on tear film molecular biology which have been done, and in the complicated cases versus the normal cases, and altered frequency and amount of the immune response related markers have been done, and it shows that these factors are really very crucial for the success of the surgery. And perioperative factors that are very important include the surgical technique, the anti-inflammatory agents, antifibrotic agents that we have used during the surgery. And postoperative wound healing related modulation is also very important. The modifications include single scleral punch sclerostomy, flap not being cut to the limbus, adjustable sutures, large treatment area with antifibrotics, and many other factors which have already been dealt with and will be dealt with later on, and consequently the blood function and morphology can improve. The spacers which are implanted, like the Ologen implant, is a potentially useful implant, and it is very important to understand that it is probably the safety improving factor and not just success improvement factor as of now. In the postoperative phase, the 5 fluorouracil injections are very important, and whenever they are to be used to the optimum level, neither less nor more. And with the current experience, the failing blebs are improving very well with the 5 fluorouracil injections given at the appropriate time. And now the role of aqueous humor flow is also important. How the aqueous humor related flare differs with a plain tropicoloctomy versus a cataract surgery has been studied, and this is one of the things that really shows how the combined surgery outcomes may differ from the trabeculectomy alone that has been taken up, and how the steroids are to be given is important, because otherwise the scarring will again start and increase. Another important factor is that hydrostatic pressure of the aqueous humor created by the aqueous fluid is to be understood, and therefore in the initial period of the postoperative phase, the pressure should be under good control. Otherwise, what will happen is that the hydrostatic pressure related factors will lead to increased scarring. So these are studies done with tube surgery, and this experience is also reflected by our modification of trabeculectomy related protocols. So keeping the IOP low in the early postoperative period by good control of the sutures, appropriate timely intervention of releasable sutures or laser suture lysis or bleb massage is very important aspect. Otherwise, the hydrostatic pressure related vicious cycle will start, and they will lead to scarring, and ring of steel like appearance. Now, so many other factors are being studied. Although much research is required, the research is not yet complete, and therefore, probably in the next coming years, more and more discussions on these aspects like TGF-beta receptor kinases will be coming into our discussions. And someday we may be able to predict the risk factors of scar formation after glaucoma surgery based on patient's own genetic profile. To summarize, the quest for blood to be perfect is on, and with surgical techniques and healing modulation, the effective surgery will definitely come in the future.